All right, let's talk about people. This is a cover from 2003 from Time magazine. That's Hillary, who has the unfortunate distinction of being the cover girl for the then dawning awareness of type 2 diabetes in children. She was 11 then. In this same issue was a study that showed the efficacy of metformin. You know what metformin is? It's a very common diabetes management drug. And the study showed the efficacy of metformin for treating pre-diabetes, for people who are likely to become diabetic in the next 3 to 5 years. Metformin showed a 30% reduction in the risk of becoming diabetic among people with pre-diabetes. In the same little stat box, showed all of the different variables that were tested. One of them was lifestyle change. More physical activity and better food as one category. 60%. 60% reduction in risk. Twice as good as the drug. Twice as good as the drug that made Pfizer executives jump up and down and blow horns. They were so excited how much money they were going to make. Right? Do me a favor. Don't talk about obesity anymore. Okay? It is loathsome to my ears. Talk instead about inactivity and good food choices. Here's another stat for you. Since 1998, the number of teens who are obese has stayed flat. That rate hasn't grown. In 1998, 1 in 10 teens were in danger of becoming diabetic. Today it's 1 in 4. Right? The correlation between obesity and diabetes, I think, is often overblown. And I think the role of activity is really undersold. And number 3, keeps propping up, right? The University of Missouri last year did a really neat piece of research. They took college kids who were physically active, and they asked them to become half as active. They didn't ask them to become couch potatoes. They said, do half as much as you're doing now. Okay, and then we're going to measure the insulin that your blood is carrying after you eat. It's called postprandial insulin. That's what they were going to measure. What they found is that in as few as 3 days, these college students, at half the activity they were doing, expressed markers for prediabetes. In 3 days, that's all it took. Trails encourage people to make the non-motorized trip, to walk or bike. And I will wager, even though it may be a sin, I will wager $500 that in 5 years, we will not be talking about physical activity. We will be talking about outdoor physical activity. I watched the research. It's piling up. It's piling up. That sun is good for us, right? That bioactive chemicals fall from the tree canopy and improve our memory. We're going to find that being outdoors, physically active, is what makes a difference in quality of life. Let's explore the parable of the treadmills and the toilets. I have to credit Mark Fenton with this one, he's a walking advocate. Back in the 1700s, a researcher in London, it was like the first piece of public health research, discovered that, hey, the reason everybody's getting sick is because they poop in the streets and they pee in their house. You know, if we could get some kind of, I don't know, sewer system here and fresh water delivered, I bet a lot of this stuff would go away. Where has that taken us? Well, the developer wants to come in and he wants to put in 100 houses. What's the first thing he has to do? Right? He's got to have his plan for waste removal and fresh water. Think of what that takes. It takes a planner, it takes a public health official, It takes public works. It takes an engineer. When have you ever seen that group of people get along over a trail project? In the same room where a trail project's being talked about. It doesn't happen, right? But it happens for our sewer and our fresh water. In Haiti right now, cholera is burning through the countryside. Okay, it is. Why? Because the earthquake knocked out the health infrastructure that they had. And where they see disease cropping up is where the network is broken. Where do we see the prevalence of diabetes? Where do we see the prevalence of heart disease? Where our network is broken, right? And people say, well, the physical fitness side of quality of life, that's on you. That's your responsibility. We don't do that with toilets, do we? As a public, we take responsibility for that. I mean, think of it. What if instead of a fitness center, we had toilet centers? Right? You could join. Hey, you know, we've got fresh water there too. You know, we'll give you a deal. Well, I can't afford the club. Well, I can't, get there. It's too far away. Well, my goodness, if you can't take responsibility for your own hygiene, then we don't have anything to do with you. Right? It's ridiculous. It's ridiculous with health infrastructure that involves activity as well.